get started since lots of people have joined us. Hopefully a few more will drift in as we proceed. So thank you very much to everyone for coming through for this, which is now, I think, our 6th seminar in the series. We've got quite a packed agenda today with 4 different presentations, which are going to focus on aspects of M&E and health data. We've got 2 speakers from JET Education Services, 2 speakers from Genesis Analytics, and Dr. Musa Mabasso from the HSRC. So without any further delays, Charlene, would you like to start us off? And please do just remember to pop questions into the chat as we go along.
Thanks very much, Julia, and thank you for the invite. We're honored to be here. I work with JET on a JET streaming program, which is a capacity building program. But what we're going to share with you today is a bootcamp methodology for research that we piloted and have now done over 3 different boot camps since the beginning of March. So let me start there without further ado. So it's the 16th of March and there's an announcement that we're going to go into lockdown. So between 16th and 27th, JET Education Services asks itself, well, what can we do during this time? And how can we do it so that we can involve as many voices as possible and that we are able to enable projects to build back better, specifically in the education space. So the idea was that there were 3 pillars that we thought were critical, and they were to establish a collaborative effort to find solutions that were informed by evidence-based approaches, and for us to allow for real-time inputs in the process. So we began in March and we ended our first boot camp, what we called a boot camp, in May. So we decided that what was really important was to involve as many people as we possibly could and drive an activism and voluntarism approach to doing this research. And part of it, you know, not a small part of it, was also keeping researchers busy. And who better in a COVID situation to keep busy than researchers who are able to work from home? And so what we did was we recruited and we got 325 applicants in the space of 2 days. And all we did was said, are you interested in being involved in research on education and COVID-19 and the impacts? And would you do it for data? Excuse me. So you had to be wanting to make a difference, and JET put a project management wraparound and utilized the Google platform because that's the one that we're the most familiar with. And we did a shared documents approach with accessible reports, visuals, social media, virtual meetings, weekly meetings that were led by a theme lead. So we brought in the experts for a theme that they would be interested in following. For example, we had a theme on what is education at home during a lockdown? What are the innovative financing models that we should be looking at post-COVID? What is the impact of fake news for youngsters, especially high school kids during this time? So we generated like 12 reports and we established 12 themes with about 10 to 12 people in each, led by an expert. And then we surrounded that with international peer reviewers and local peer reviewers. So there could be 2 or 3 to a group, and they were involved in the process along the way. So it wasn't the standard peer review, you get the thing at the end. We actually made sure that we cut through the bottlenecks by involving the peer reviewers along the way. Their pros and their cons, and I'm sure we can discuss that. So it ended up being a very agile, evidence-based approach. And we ended up with the kind of coverage and outputs that I think can be utilized in many different sectors. So you'll see on the screen right now is the kind of things that we were talking about. So, for example, unlocking the lockdown mindset was about finding ways of helping teachers and helping people in the sector rethink how it is that they were doing and what kind of data sets would be available, what kind of teaching material would be available, etc. So you're welcome to pop along to our website. You can get any of these reports. They're available there, and they're there with an infographic, which gives you a nice one-page sort of summary of each of those reports. And if we developed a tool, for example, there's a fake news tool there that could be downloaded and used in the classroom by a teacher. On our theme 11, in fact, we developed a tool that's been taken to the DHET and was developed by Professor Lee Rusniak with Dr. Patterson. Who is it? It's a whole bunch of lecturers, professors from UJ, WITS, Stellenbosch, including people like Maureen Robinson, KZN, Carol Bertram. And in theme 11, they came up with an approach to pre-service teaching in a time of COVID. Now, the other sort of what would you call it, a lure, a thing that, so besides the data that we gave all of the researchers, we introduced digital credentials. So for your work in the projects where you've written up sections of the paper and you've done research, you've maybe developed data instruments, we did different things across different groups. And so we would then speak to the lead researcher and they would confirm that this person indeed has contributed in a way that's sustainable and that we can actually accredit. And so we then issue these digital credentials through a company called Privy Seal. So when you go onto an email, you might see one of these, and if you go onto their QR scan, it'll take you to a certificate that was generated. So the way we got those recruits in, data and digital credentialing. We also issued podcasts as part of this process, and we did a whole lot of work on Twitter and on Facebook as well. And you can pop along to our YouTube channel and you'll see that when we got to the live streaming, that's when we were launching each of the reports. So some of those are just an interview with the theme lead, and one or two of them are with panels of people. So this would just give you a quick overview of some of the things. There are reports on the site that give us a sense of what kind of insights to action we were discovering along the way. And, it's not rocket science, but the idea of the fact that online is, exclusive rather than inclusive. And how do we go beyond that were things that we were trying to really work our way through across the different boot camps. And just to say to you that it got such a good following that UNESCO came along and then began a second boot camp, which we call the Sadek Researchers Boot Camp, which has got about 15 countries in the Sadek region. And we had 447 applications there, and we followed the same approach. And they did 6 reports, which you can see on the site. And then important tools that we used along the way were to do midline survey feedback into the group to see whether researchers that had joined us were feeling as if they were gaining from this experience, because we had a whole lot of junior researchers with us. So we felt that that was an important element. And it then led us into the last boot camp that I'm still running at the moment. So I'm known as the boot camp commander. I don't get to do much other than chase people for reports. But nonetheless, it's like 469 applications. We're doing 14 themes at the moment. So it's the biggest boot camp that we've run so far. And I thought what might be of interest to you is that we've developed tools. So this was a Google spreadsheet, in fact. And these tools enable us, so this is a dashboard, it enables us to see um, at the bottom all of the scheduled meetings, and that we could then connect from across the different groups. People could pop into different meetings if they had time. And all of these people volunteered. So it's very much relationship reliant. And I think that's a really important thing when we're talking about collaboration and how we bring this together. So we used what we called a project management tool, which made it really simple, where we showed how researchers would benefit, how the education sector benefits, what we anticipate as outputs, and we had all of that loaded so that any theme lead or a co-lead or peer reviewer could have a look at that at any point in time. And we used centralized Google Docs to create the background so that you had access if you were a junior researcher in the middle of Uganda, and you've obviously got your data, etc., and you could access a shared drive, and you could see the progress of your group at any point in time. So I think it leaves it for me to say that we've involved across the Commonwealth another 29 countries. So in the last 6 months, we've done this across over 40 countries. And we think that there is something in the process that even lecturers and professors from overseas have said they've taken away a new approach to perhaps dealing with multivaried language levels, time zones, all sorts of things. But I thought what I should do is bring in my colleague, Tsepo Boloy, and let him just give a sense of what it was like to be working as a coordinator in the boot camp. Tsepo, can you take over for a moment there while I swap slides for us?
Thanks, Charlene. So yeah, basically as a coordinator for the bootcamp, it was quite an interesting and like a learning experience, which was yeah very appreciated, if I may say. So Charlene, I saw you were speaking on the dashboard. So basically, I my name is there on the dashboard as well as the coordinator. So basically, what happens with the dashboard is that since the Commonwealth Bootcamp is across multiple or various countries, so it would enable us to actually be in like sync in terms of which meetings are taking place, and considering the different time zones as well. It would, like the dashboard would actually enable us to pop into meetings or know which meetings are taking place when, so that we can all be in the same spaces at the same time, regardless of us being in different countries. However, so for me, I personally was interested in like compiling a presentation on the experiences of planning to use remote methods, since as a coordinator of the bootcamp, I was observing and like I was coordinating an online platform or research, and also as a jet streamer at Jet Education Services, we are in the process of actually finalizing um, pieces of papers on the ECD landscape, which is something I've also done remotely. So I've done fieldwork on that remotely. So I'll be giving, or I'll be going through experiences in like planning, or yeah, in planning to do remote research. So we can move on to the next. So in me preparing this presentation, I looked at most at the following aspects as my particular interest when I prepare for for doing remote research. So basically, I looked at the research geographical landscape. I looked at the research sample, the data gathering methods, data gathering tools, and researcher competencies, and the online safety for the data. So going into the geographical landscape, we do notice, or we can all agree that South Africa, the access to mobile cell phones is actually great in South Africa. But however, regardless of it being great, there is still a digital divide in terms of the affordability of airtime, data, and like, which now brings about the issue of connectivity, since mostly when you do in like remote research, you will need access to internet. So if there is a digital divide in terms of affordability of airtime, so then it becomes hard for people to be able to get online and participate in research, if I may say. So the other most important thing that I came across was that we need to be very mindful of exclusionary factors, which may relate to the economic landscape of the research sample or the research environment in which one wants or looks to do their research. We're looking at also the cultural like factors in that particular area, and we also so we're looking at the environmental, cultural, and economical aspects. So with with regards to the cultural aspect, I think it leads to my next slide, which speaks on the research sample in a sense that as I was like reading across literature in terms of how do we go about doing remote research, I found out that in India, most of the females don't have access to a mobile phone. So the males in the households will be the ones who are actually in charge of, or who are like in possession of the phone. So if you are considering doing a study that requires female participants, then it will be very difficult for you to reach those particular intended participants for your study. And again, if we take it back to South Africa, you might find that there are spaces like in the rural areas where you still need, like looking at gatekeepers, you still need permission from the chief or from the induna of that particular place to actually work in their space, regardless of whether you're working online or not. So those are some of the things to consider which relate to the access in terms of the sample of your intended study. And then so this also will mean that it will take more time, effort, and creativity from the side of the researcher, since it's not something that you go personally in terms of like on the ground. You have to do it virtually, and like you have to now access the records in terms of details, contact details of the participants that um, you want to participate in your study. So the other thing I considered was like the kind of like sampling method that you use will also have an influence in terms of what like the outcome of your study. Because one thing I found is like snowballing works very well when you are actually doing a remote study. However, it creates some sort of a bias, in a sense that now you are getting people who are maybe in the same circle. So that's also something to be very wary of when you're doing, like when you're preparing or planning to do a remote study. And then the other major important thing is that you need to be aware of like the literacy comprehension by the participants, in a sense that there are methods or there are tools that, like for example, if you are doing phone calls, you can engage, but there might also be a language barrier there, but you can engage with a person who can't read and write. But if you are doing an email or a kind like something that requires like comprehension from the participants, then it becomes quite difficult for you to access or do the research in that regard. And also that the messages need to be very like culturally and like appropriate, linguistically appropriate, in a sense that you can't go to a township and be speaking like rural language, or you can't go like vice versa, go to a rural language and be speaking slang and expect to be in sync with the people that you are recruiting for your study. So as I mentioned, so I'm going into the gathering methods. So basically, when we are doing remote research, I found that there are three methods, which is the SMS, the interactive voice response, which I feel like most of us have in a way recently came across this one in the form of maybe adverts or funeral covers or any like policies that are trying to recruit you to be part of it, which I don't know how people feel about it, but that's a story for another day. So and we also have like computer assisted telephone interviews, which uses the live interviewer, and in this case that's where mostly I think qualitative like inquiries would be very much suitable for. So I go through examples of the tools in this regard, starting with email, and I look at the advantages and disadvantages. So basically with the email, I feel like the major advantage of an email is that you get like you are able to probe and you get responses transcribed already, so it like eliminates the need for transcribing or hiring a transcriber. However, the disadvantage may be that the research participant will need to be very comfortable in terms of uh, typing, like in terms of like, yeah, expressing themselves through text, if I may say. And then I looked at also the telephone call in terms as a method or as a tool of collecting data remotely. So basically it like the main advantage of it is that it is cost effective and time effective, in that you can do it anywhere and you can reach people from anywhere. So, but the disadvantage, as I mentioned earlier, would be that there might be a language barrier. You call a person, they speak Venda, you speak Zulu, then there's a language barrier. Or you might find that you call a person thinking you are calling Charlene, only to find out it's Charlene's daughter who's on the phone. But since you don't know, you can't truly like verify that you are speaking to the daughter. She can still pose as Charlene. So I looked also at the computer assisted, which are the Zooms type Google and Google Hangouts. So basically with the advantage here is that like the one I feel like is mostly appropriate is that they are geographically flexible, meaning you can be able to reach hard to reach participants, just like with the bootcamp. We were doing focus groups with people in different countries at the same time, which is one of the major advantages. And the major disadvantage in this regard would be connectivity challenges, in that people might not have data, might experience blackouts and things like that. So the last one, which I feel like would apply to a wide range of participants, would be the SMSs, in that it like the major advantage is that it doesn't require a smartphone for one to be able to receive an SMS. And then the disadvantage would be that you wouldn't be sure that the person has actually received and read the SMS. So having looked at the like the methods in which remote data can be gathered, I looked at the tools, and basically here I was just looking in terms of now methodology, in terms of how do we align the tools and the methods in a way that we are able to gather the intended data that we need. So my first point here is just a caution that we need to actually align the tool with the method, with an appropriate method, in a sense that you don't want to find yourself in like doing a survey and having a tool that's relevant for and like a qualitative inquiry, doing a survey maybe through call, because participants may run the risk of being fatigued, since surveys will take longer than when you are actually in a focus group, or yeah, vice versa. So, and again, the other thing I found when I was doing my ECD paper, which is in the process of peer review with JET at this point, is that some of these methods, like when you're doing, for example, mixed methods in research, online remotely, so it's like you need to, the methods, they complement each other. So you will run a survey and then maybe complement it with call or with Skype or Google Hangouts, so that you get like in-depth understandings to supplement the um, data that you shall have gathered. So I looked also at the three methods of data collection in terms of their advantages and disadvantages when you are doing them remotely. So basically with semi-structured interviews is that they are very interactive in nature. So then the disadvantage would be that it's like suited to video and call. So basically you can't, like, even email does apply to this, but as I said earlier on, you might wanna, like, the participant will have to be very comfortable in expressing themselves through text, and then you can't necessarily leave the questions with the participants, since there will be a need for probing the questions. And then with focus groups, what we found with the boot camps is that focus groups, when you do them online, they are actually, they take less time as compared to when you do them like in person, and they are very cost effective in that they, like, there's no travel, there's like no refreshments, and so with the major disadvantage would be that if you have to demonstrate like physically anything in the focus group, it takes away, the remote focus group takes away that uh, opportunity, in that there's no senses there. And then I looked also at the survey or structured questionnaires. So the major advantage is that they are actually faster and like straightforward to actually administer. However, the disadvantage would be that they require a certain software which most people might not have, like a compatible device to actually access. Let's say we are doing it on uh, Google Survey or Survey Monkey, so people might experience challenges in getting that particular software. So looking at all the aspects that I presented so far, I figured that it's not only about the method in which, or the preparing, we also have to look at the actual researcher in terms of how, like, their competencies. Basically here I looked at like the issue that the participants, they will need support in terms of covering the cost in like of participating in our studies, and then also that we need like the technical skills, because it's quite surprising that even us as researchers, we are not good as we think we are when it comes to this online platforms. So we still need that training, we still need that support for us to be able to actually ethically and effectively carry out this research. So the last point I looked at is the safety of collecting that online data. So basically there are risks involved with regards to collecting online data, because I'm sure maybe if not all of us, we've came across an incident where Zoom meetings were hacked by external people. So how do we protect ourselves from such incidences? So that, and we know that like we need the credibility of the data, as the ethics requires us to actually store data in a way that secures the confidentiality of our research participants. So that means the concerns on there's on the online platforms need to be actually the safety around that need to be considered when planning around conducting online or remote research. So yeah, that's my experience, or that's my views in terms of when we plan on doing or collecting remote data. Thank you.
Wonderful. Thank you so much to both of you. That was a really lovely pair of presentations and really great to see sort of how the overall process delivers specific project products. We've got a few questions coming through in the chat. I think Stembiso is just going to pop them up on a slide for us. Charlene, if you and Chip would like to respond to some of these.
Oh, those are good ones. Thanks very much. I was just looking at, I'd love to hear a bit more about the pros and cons of the integrated peer review process. So what we did was, in some cases, we had 2, possibly 3 peer reviewers. And what that allowed, and this was not done as a plan, it wasn't something we thought about beforehand, but it's turned out, and then we were able to apply it across the 2 subsequent boot camps. So it wasn't planned in the SA boot camp, but it sort of arose. And that was that some peer reviewers are far more closer to the process. And when you had 2 or 3, one of them might rather be involved near the end. So that actually helped in the collaboration. So it brought an expert much closer to the process during the process, and then having someone who had an outside view because they weren't as close, which really helped. So my view is, like, in the next time we started to iterate it out, we found that that's been very useful. And it's builds a lot of strength when you've got a bit more depth. Even, peer reviewers can have multiple different views about something, but it allows the jet editing team to be able to kind of integrate those things. So I don't know if that answers your question, but it's you have to manage it like relationships. Peer reviewers, not all of them, but some are divas. They're experts in their area, and so rightfully so. You have to utilize your best relational management. That means communicate clearly. They need to understand what the scope of work is upfront, etc. So someone says this is incredibly inspiring. Thank you for that. And the thoughts around what aspects and dimensions will be most valuable into the post-lockdown. Well, the one thing that I think we've realized is that we could do this before lockdown as we can after lockdown. And perhaps there's some ways here to unlock different aspects of the education system through more collaborative approaches. And it may not just be for research, but perhaps for writing workshops, for example, that could be done more across the different languages. It's just an idea that I'm sitting with at the moment. It's not necessarily a research strategy, but it's using the same format for a different content objective, if you like. Okay, so Tsepo, are there any questions you want to pick on?
No, I just wanted to add on your last comment that in terms of, again, taking this post lockdown, is that one other thing is that we've made, like, in a way, networks. We've made connections that will, like, across the world now, not a matter of only in South Africa. So I remember when we did our closeout meeting. So my team lead, who's like Deborah, was like, no, when you come to my side, just know that, just let me know so that we connect. So basically, and like, if now I'm doing research that's in her, like, kind of like field of interest, I know I can always pick on her brain to say, okay, I'm researching this. Would you be interested in like sharing views or sharing ideas and papers? So that's the other thing that I feel like we should also acknowledge with regards to the boot camp. Thank you,
That's a
Charlene.
that's a very important point, Seppo, is the networks, and the leveraging of your networks and bringing people more into the collaboration from a variety of different stakeholders. This was something that we hadn't really done before in this kind of way, and we were really surprised by how people were very keen to get involved, even on a volunteer basis. Um, so we used to Tara's question, we used mainly the Google platform, and because as an NGO in South Africa, we have the full package of the Google Drive. So it was the shared Google Docs, Google Sheets, Google everything, Google Forms. And we did most of our tool development on Google Forms, that were online. But I see Naima asked the question around accessibility for the majority of South African learners. And of course, in this particular case, we weren't dealing with South African learners from school level. We were dealing with graduates mainly, from honors, master's level up. And of course, I think it's obvious that if they didn't see the thing online, then they weren't able to apply. Um, but I think we know that through this research, we've got to find ways. It's the online is not necessarily the answer. The online creates more collaboration for more creative and design thinking. And if we can harness that and then apply it, I think we will have something that's far more far-reaching. So this is a very interesting session. Clearly forces researchers to question a lot. Thank you for that. Did you have to match participants and researchers in terms of age and other demographics? So interesting across the groups, Mamokwe, is that, I hope I said that correctly, is that we had researchers from across the world, from across cultures, obviously in the Commonwealth boot camp, mainly speaking English, but nonetheless also sometimes as second language. And I think what we discovered from age group wise, we had from like 25 up to 35 applying, and we didn't have to match them per se. They got a CV, they sent a CV in, and we weighted it by looking at whether you were in what your interests were. So you had to write this 2-pager type CV, and we looked at your interests. We looked at whether you had the qualities of what we call a social change agent, and then your motivation. And when we advertised, we had our themes, and so you could choose a theme, and you had to motivate for that. And so we used those criteria. We had a waiting, took us like 4 days, 6 people, scrutinizing all of the applications and then selecting them. I hope that helps.
Thanks so much. There's one further question from Mohanso in the chat asking
Yes.
Chepo to elaborate more on your experiences with ensuring privacy of participants. Maybe if you'd like to respond to that, and then we'll hand over to Amreen and Itago.
Okay, thank you for the question. So with regards to like ensuring the privacy of participants, I guess it will depend on the tool and the method you use when you harnessing the data or the information from the participants. So for my ECD paper, so what I did is I did the Google Forms. Sorry, I did the Google Forms in which I had like like a consent form, and I had like an information form which outlined that the purpose of my study and outline that like their confidentiality would be like uh assured or ensured, if I may say. So basically what I did then from there is the responses came directly to me. So basically the person who was like overseeing my process or my ECD paper didn't actually have access to the names of those participants. It's only me who has the access to their names. Even Charlene, she's the commander also in the Jetstream program. She doesn't have access to those. I'm the only one who have access to those. So I feel like that's one way in which you can assure or ensure the privacy of the participants, because some of them I did actually snowball. So in snowballing, it was quite interesting because now I was dealing with people that like I didn't know, but it was interesting since I was doing research. So they were eager and like willing to take part in my study. So in that as well, the informed consent and the information sheet that I provided to them or to those that I snowballed from were actually passed on to the people that were snowballed as well, so that they are aware that their names were like in a way secure. So that in a way also helped them actually in like volunteering to be part of my study. And some of them were actually interested and requested for me to share the final piece once it's done. So it's in the process of peer review now. I will share it with them once it's done. I'm not sure if that answers the question.
Thanks so much. Yeah, thank you to both of you for a really fascinating and inspiring set of presentations. Our next two speakers are Amreen Chorda and Ditago Winnie from Genesis Analytics. Can I hand over to you?
Yes, thank you so much, Julia. Itago, do you mind sharing the screen? Thank you. Okay, great. So, hi everyone. My name is Amreen and I work with Genesis Analytics. Both Itago and myself are based in Nairobi, Kenya. And today we're going to be talking about our experience in collecting social data while adapting to the COVID-19 pandemic. Specifically, we'll be sharing our experiences on using integrated or interactive voice response and virtual focus group discussions. I think just one thing to note over here is that both Itago and myself have used and have been using IVR and virtual focus group discussions even before the COVID-19 pandemic. And what we want to do today is really share our practical tips for using each of these methods for data collection. Okay, so first, a lot of you are probably wondering what is interactive voice response. So Seppo mentioned this in his presentation, but what interactive response is, for those who don't know it, it's a method that allows for engagement in two-way communication with any mobile phone, even the non-basic so the most basic smartphone or non-smartphone for that matter. Such engagements offer a scalable platform to share information as well as collect rich data through pushing out phone calls. And so basically with IVR, we have worked with two partners who have offices in various countries all over the world. And those are Geopol and Viamo. And both of these partners have been very helpful in allowing us to, ensure that we're reaching very high response rates, that we're tailoring the survey questions according to the local context, that our surveys are translated, that the voices that the phone calls are being made in are reflective of what would be a typical voice in each of these countries. So I've provided the logos or the icons of those organizations here, and you can have a look at their websites to understand more about IVR. So if we move to the next slide, we wanted to share our tips for running integrated voice response. So I think the first thing to do is, in order to ensure a high response rate, it's important to send out a text message to inform participants ahead of time that this phone call is coming, and this is the purpose of this phone call, for example. What we found is it's very helpful. So both Itago and myself first work in a monitoring and evaluation practice within Genesis Analytics. And so our clients would usually send out a text message on our behalf to let them know that the survey is ongoing and this is the purpose of the survey. So please answer the call between this time and this time, for example. And we found that that really helps the chances of someone answering the phone. In some cases, like Sapo said, the women might not have access to the phone, but the husband does. And so this helps ensure that, the women can answer the phone at the time. We've also found that, in some cases, sending a text message might not be helpful, but social media can be leveraged as an alternative to SMS to inform respondents and explain the purposes of the survey. So for example, with some of the clients that we work with who run an entrepreneurship program, for example, they often have a Facebook page and they can just let all of their members know if they are subscribed to that membership page that please expect this phone call, for example. One thing that we found is that, in such cases when we are using interactive voice response, it's literally a machine that's calling the person, and the respondent does not have an opportunity to ask any clarifying questions. And this can really affect, the person's ability to feel comfortable in responding to some of those questions. And so what we do is that when we send out this introductory SMS, we give potential participants the ability to text or call for clarification. So if they want to know more about the survey, if they want to understand what the data is going to be used for, etc., this is just a really good way of allowing the respondents to communicate with whoever is sharing this information. And we often also allow, we offer a callback service. So in Kenya, you can dial *140* and then the phone number, and this allows a toll-free call to be made, for example. Another thing that we found is it's really important to run a duplication on phone numbers in your sample so that respondents aren't called or SMS'd multiple times. This also just ensures that your budget is not being exceeded because one person is being called twice, for example, or an SMS is going out twice. Moving to the next screen. So another thing that we found really helps is branding the phone number. So in some countries, the partners that we work with are able to do this. So to give you an example, if we're working for a large USAID program, we would brand the number as USAID and then the name of the program. So this just helps the participants know that, okay, this project that I'm working with is the one that's calling me, and let me pick up the phone. Then another thing that you need to think about is whether the survey needs to be translated. And in many cases, this really depends on who the respondent is. But it's very important to, of course, translate your survey just as you would do in a normal face-to-face data collection situation. And then another thing that we really encourage is piloting the survey outside of the study sample. And when you do so, it needs to reflect the actual survey as closely as possible. And we found a lot of, we have to make a lot of changes after piloting a survey through interactive voice response, because, for example, the responses that we're receiving are not what we intended. And that often means in many cases that the respondent did not understand what they were being asked. And so we make revisions accordingly to the answers that we receive. And then another tip for interactive voice response is to keep questions short and to the point. I think that this is one of the limitations and shortfalls of interactive voice response, is that you wouldn't be able to ask the same question that you would be able to ask in a face-to-face survey. And so we recommend using 20 questions max, and also at the same time ensuring that, so the good thing about IVR is it allows for a combination of multiple choice, numeric, and open-ended questions. So participants can actually also speak back into the phone. So yeah, that's just also something to keep in mind, but limiting it to 20 questions. We have used a variety of methods in the past where we also provide respondents with airtime at the end of the call. So in many cases, the partners can build this into their provisions and allow for the respondents to automatically receive airtime the moment they cut the phone. We've also worked with the surveys so that we are dividing the questions into two groups. So this 10 questions each time. And then if they respond to time incentive. So that way we're encouraging them to actually complete the survey from end to finish, from beginning to end. So that's interactive voice response. We wanted to share an example of where we have used it in the past. So I'll do that in the next slide. So maybe let me just run through the process first of IVR from beginning to end. So first you start with developing the survey, and the partners that we work with are really helpful in ensuring that, the survey and the way the questions are worded and the flow of those questions are, suited to IVR. The survey is then translated and recorded. It is field tested and modified. It is deployed as robocalls to mobile phones. Farmers respond to the mobile survey. We've said farmers because we used the IVR, for example, with farmers in the past, and then the results are received and analyzed. And I think another really beneficial thing about the partners that we work with is that they are able to provide live dashboards of the results. And so you can track your data as it's coming in. Moving to the next slide. So one of the things that we've used IVR for, like I said, is, to interview farmers. And so there was a program that we were working with where a financial institution in Kenya was providing farmers with a program that was, a financial bank account, basically. And what we wanted to understand is, before this program was designed, how do farmers save their money, and where do they borrow money from? And so what we found is that mobile money is one of the sources, for example, where farmers access credit from, and so are savings groups, for example. And we can see that banks are not so high in where farmers access credit. Yeah, moving to the next slide. So, what we were also interested in understanding, this is another program, was whether farmers were carrying out vaccination practices for their cows. We worked with a program that was providing training to dairy farmers with the purpose of understanding whether this program has had an impact on their good best practices. So for example, whether they were vaccinating cows. And so, we just asked them, when was the last time that you have vaccinated your cows? And we collected that information, and then we were comparing that between farmers who are trained and farmers who weren't trained. And so again, this is just a really useful way of, collecting data to understand how much, whether first farmers have been vaccinating their cows and how much they've spent in the last month or so on vaccinating their cows. Next slide. Another way that we've used integrated voice response is on a tool known as the Poverty Probability Index. So this is a 10-question survey that aims to understand the likelihood of poverty that people are in, and it is tailored according to multiple countries. I think it exists for about 30-something countries now. And one of the questions, for the PPI in Kenya is whether what forms of transport people own. And so what we asked our respondents is whether they own a tractor, whether they own a cart, and whether they owned motorbikes. And so we are presenting that information for two different groups of people. So like I said, this is just, a really easy way of collecting data on simple questions, which, would otherwise be very expensive to do. And in COVID right now, you wouldn't be able to do because of lockdown and because of social distancing. And so we just created this table which shows what factors need to be considered depending on what method you are using for data collection, all of them being virtual. So there's integrated voice response, there's SMS surveys, there's online service sent via email, and there's phone surveys or CATI, computer-assisted telephonic interviewing. And yeah, we present, the cost, what response rate you can typically achieve, and what factors need to be considered in each of these. So I think this presentation will be shared with everyone later on, and you can refer to that. We're now going to talk about virtual focus group discussions. So I'll hand over to my colleague, Itago.
Thank you, Amreen, for that. So I'll talk briefly about virtual focus group discussions. So usually in the process of data collection, focus groups are held as a method of qualitative research, where groups of people, whether it's youth, stakeholders within a specific sector, are brought together to hold group discussions and talk about their beliefs, opinions, thoughts, and just their understanding of perhaps, and give feedback perhaps on how a program has been able to support them or result in good or positive outcomes for them. So for focus groups are a quick research technique which help in collecting data when you have at least maybe 8 to 10 people when it's face-to-face. You have the participants invited and they have a conversation with a moderator, usually often lasting about 2 hours. However, given the COVID restrictions, it's been difficult to hold focus group discussions face-to-face, or even to travel to countries to collect such qualitative information from a large number of people using group discussions. So then one of the things that we've done more recently, or rather increasingly, is running virtual focus group discussions. So this is something that we did also before COVID as Genesis within the monitoring department. But then also it's something that now increasingly we are noticing even with clients. They are requesting for virtual data collection, and one of them being collecting information from using focus group discussions. So I'll go over factors to consider when designing and running a virtual focus group discussion. And then I'll end with just a brief overview of Zoom, which is one of the methods that we've used for running virtual focus group discussions. So a key at the design phase, there's 4 key things that you need to consider. So the first thing is connectivity to internet and the hardware. So often focus group discussions, we've run them with people from farmers all the way till entrepreneurs. And usually the best way to gauge this access to internet connectivity and hardware is by liaising with the client themselves and just understanding what level of connectivity the beneficiaries have to internet and laptop or phones that are smartphones. So this is a key factor to consider to see if having a virtual focus group is at all possible. If you get a scenario where it's not possible to connect whatsoever to the internet, or the beneficiaries do not have smartphones or laptops, then a different way that you may need to do this, which might also be, which will impact on the time spent on collecting data, would be having short interviews with each of the participants and then joining the dots between the participants. But then if you do establish that the beneficiaries have internet connectivity, or there is a center where they're able to meet and have a virtual focus group discussion, then that's something that should be one of the first key considerations. So the second thing that it's important to consider, as has been stressed by Amreen and colleagues from JET would be understanding and speaking the same language as the lead within the focus group. So often focus groups are held with, often most people speak English, but then when you're speaking with youth or even farmers, young people, it would be very important to understand the language. So for instance, maybe about 2 weeks ago, I was conducting a focus group with people in Tanzania, and the main language spoken there is Swahili. So as being in Kenya, Swahili is something that I'm very familiar with, but if I did not have the capacity to speak and understand Tanzanian Swahili, which is slightly different from the Kenyan one, I would need to have had a translator or someone to help in guiding the conversation. So the downside of having someone as translating the focus group would be a lot of things sometimes are lost in translation. So you would need to have someone who's very experienced in translating focus groups and also experienced in facilitating group conversations so that they are able to know also when you ask a question and you intend to probe on those questions, how can they as a translator support you to also gain the information that you need from the focus group. So the third thing is to also invite a limited number of participants. So often when we do face-to-face focus groups, you have 8 to 10 participants, but the virtual nature of this interaction would need a maximum. We've found like a maximum of around 6 to 7 would be the optimum number for the virtual focus group discussion. When it's more than that, it becomes more difficult to manage the conversation, which also goes to and I'll speak about this in the next slide. You would need to use some tools to just break up the participants and have like smaller discussions and then come back to discuss things that were discussed within the breakout rooms. And then the last thing is due to the virtual nature of the focus group discussions, also limit the number of topics and the questions. So often what we would do, we would have like let's say a 10 question guide for the focus group discussion when it's face-to-face. But because when it's virtual, people often lose their concentration very easily. Maximum amount of time like a human brain is engaged online is about 20 to 25 minutes. So in limiting the topics and questions, we recommend keeping virtual focus groups to a maximum of 1 hour, where people, which has been a sweet spot so far in the virtual focus group discussions. So in terms of the topics, what helps is creating themes from the key questions. So if you have 10 or 15 questions, create, let's say, around 5 key themes and use those themes to elicit reactions or elicit comments from the participants within the virtual focus group, so that it's also less of a question and answer session, but more of a conversation with just key questions around those themes, which will eventually now feed into your main focus group guide. So another thing to think about now is during the preparation and setting up of the virtual focus group. So the first thing to do is to inform how they will be required to connect ahead of the meeting. So usually we would send either an email or a text message or ask the program coordinator to communicate with the beneficiaries on how they will be joining the conversation. So we usually have a YouTube video that we send on how, if we are using Zoom, this is how you set up Zoom, download it, this is how you join, this is how you mute, and just the basics on using Zoom. Sometimes things that are rather obvious for us, given that we are more or less professionals who are used to using Zoom, are not obvious to beneficiaries or people who often don't use virtual methods of connecting with other people. So it's very important to prepare people ahead of time. And then another important thing to communicate is, will they be turning their videos on? Often people are averse to turning the videos on, as evident in this call, but it's very important to communicate to people ahead of time. We will be turning on the videos, so just make sure that you're sitting in a space where there's limited distractions, and you have, if you can turn off your video if your internet bandwidth does not allow it, but as much as possible, keep your videos on. So that's on the prepping and the setup of it. And then now on the virtual focus group itself, when you start the conversation, it's very important to keep your video on, because this is the only way that the beneficiaries or the participants are actually making, connecting with you. So it's very important to turn on your video when you're making the introduction, and at the end, when you're thanking the participants. Then in between, the videos can be switched off just to maintain internet bandwidth. And then the second thing that we've done effectively, given that sometimes you'd have about 6 to 7 people, and people may not, it's difficult to call on someone as you would in a face-to-face setting. So then assigning numbers to people, and then letting them respond to the questions in order of the numbering. Or if it's you're running out of time, you can say, I would like to elicit responses from the odd numbers in the room or the even numbers in the room. So that way there's also some system, some randomization to the numbering or the responding. But assigning numbers really helps in running the virtual focus group discussion. And then the last thing I'd like to talk about is tools that we've used. So one of the key things we use in face-to-face conversations is pocket voting, which helps as an icebreaker, but then also it's a good system for collecting quantitative data for qualitative information. So often when it's face-to-face, you have a few envelopes in which they put tokens, or they put marbles, depending on like what's the challenge or what's the key conversation. So for the virtual focus groups, it's important you can also use Zoom polling, which at any given point of the conversation, you can set up these polls. So often at the start, it would be good just to gauge, let's say, their thoughts, things like on a scale of 1 to 10, how would you rate your experience with X and X? On a scale of 1 to 10, how effective was communication with this client? So having those polls at the start helps in breaking ice, and then also gives ground for you to have conversations, to follow up the conversations based on the polling results. And then the last thing is having breakout rooms within Zoom, and I believe other online applications for group video calling also have breakout rooms. So the breakout rooms basically just help in managing conversations. Let's say you have 3 or 4 topics that are very important to speak, but you have 10 minutes left. This is something that can be divided out into breakout rooms. People go and speak about those key things, and then they come back into the main conversation and present on what was discussed in the breakout rooms. So the key thing to note for breakout rooms would be, let's say you have a conversation with around 10 or 15 people. It's very important that for each breakout room, there's someone from Genesis or from your company who is listening in on the conversation and taking the keynotes, because otherwise it would be difficult to get feedback from the participants by themselves if they have not, if they were not taking notes, or if there is no one to also help guide the conversation between them during the breakout rooms. Okay, then the last thing, this is just like brief presentation of Zoom. Zoom is more on the affordable side of things. And I think when you have a pro account, it's very easy to have conversations longer than 1 hour. I think that's the limitation of the free Zoom account. So when you have a group call, you would need to have a paid Zoom account. So the $15 per month has worked so far, at least on our end. But then this is always something that as an organization, people can sit down and consider what is the best way forward. There's many other applications out there that are used for webinars or for providing, for engaging with people virtually, but what we've used primarily is Zoom. Yeah, thank you.
Wonderful. Thank you so much, Amreen and Itago. And I really, really appreciate the generosity you've shown in sharing all of your learnings with using these different methods. We've got a couple of questions and comments. I think Stembiso will pop them up in a minute. If anyone else wants to ask a question, you're also just welcome to raise your hand and signal that you'd like to speak.
Julia, should we just go about answering the ones that are there?
Sure. That would be
great.
wonderful.
Okay, great. Okay, so the first one, so I guess the considerations that guide the choice of the voice of the interactive voice response is really who the participants are, or the respondents are. So for example, in the case of, for example, youth, we tend to use like a woman's voice, but that's soft, for example, so that, you know, they feel comfortable. I guess youth feel more comfortable speaking to women. I'm trying to think about what other options guide, what other considerations guide our choice. I think it just really depends on who the respondent is. And for example, if it's a woman respondent, so if we're working like on a program that is specifically targeting women, we are likely to use a woman who would make that phone call. Yeah, I think that's it. I don't know if Atago, you have anything to add.
No, I think you've captured that quite well.
Yeah, okay, and then I think it definitely does play out in our response rates. I think we've noticed that in the past, where we are, for example, using a man and there is a female respondent, they feel less likely or feel less comfortable responding. Yeah, Itago, do you want to take the second question?
So this is if we've experimented with other platforms other than Zoom. At the moment, no, we haven't. I have participated in platforms that have used Microsoft Teams, and I think there's an application called Webinars, which was also relatively easy to navigate. But our reasons for using Zoom, I think it's because it's something that as a company, we're quite familiar with, and we've built our capabilities and just been able to be trained on how to engage with different people or engage with multiple groups of people using Zoom and its different functionalities. So for us, I think Zoom has worked really well. And of course, like just setting up the call to have the security measures in place, limiting participants, ensuring that security is on, people not anyone can share, only the hosts can share, which are some of like the guidelines that we have followed to avoid any form of like Zoom bombing happening. But so far it has worked well for us.
Wonderful. And Charlene shared a couple of comments related to her experiences. I don't know if you're able to comment on those at all.
So I'm just reading that first comment on creating face-to-face hubs with internet access. And maybe Charlene, you can also tell us a bit more about that. But like, if I understand what you're saying is having a space where it's online, as the facilitator, you connect online, but the group is probably still face-to-face within the same room. This is something that we have also done, or and I have done in one of my projects, where we were evaluating a group of youth within an education program. So it works. But it just means that you would also need to really work with the project coordinators to ensure that the participants actually travel to the hub or travel to the office. And if there's provision of whether it's like transport or snacks reimbursement, that's something that also needs to be considered the moment like someone has to leave their house or their workspace to try and like attend the conversation.
I would agree with that, Itago. So that's what we're doing in some of the classroom spaces, and working with teachers, and having to, bring schools together maybe on a sort of smaller scale, face to face, and then bring those that can join online. It just means logistically you have a few more complications, which you already pointed out.
Yeah, thank you for that. The second thing is an interesting fact: data in many other countries was cheaper than expected for boot camps, not the case in all. Are you able to speak to that, Charlene, also?
Yeah, Itaga. So South African data seems a little more on the expensive side. So where we might pay 300 Rand for 3 gigs of data here, you might find that in Uganda or Cameroon, you're paying 300 Rand for 10 gigs of data. So we just had to manage that across the boot camps, because it didn't mean that you spent less necessarily. Because we felt that actually a Cameroonian 3 gigs was almost just as expensive as their 10 gigs. So why would we not get them the 10 gigs? So those are things, because we weren't doing a measurement of sort of, and looking at parity. We were looking at how you got involved in our research. We weren't too worried whether we were giving you 3, 6, but we were trying to give you what you really needed in your country. But that's what we discovered. So I've got a list of about 140 countries now with the different data costs.
Okay, thank you for that. And I think that's also related to Tsepo's question on reimbursement for data and airtime. So for IVR, we have not reimbursed for airtime because the call in itself is free on the recipient. But given airtime as an incentive for completing the call. So that's something that we've done. In terms of the guidelines on how, if we have a procedure on determining how much that reimbursement is, usually we do not reimburse more than a day's wage in airtime or in whether it's transport or data. So because then that also might lead to response bias, where someone feels like they're very grateful to you for giving them more than what they would have earned on that day anyway. So often, as you've mentioned, Charlene, yes, data and airtime is much cheaper outside. I've found that when I'm in South Africa, I spend much more on data and airtime than in Kenya. So for different countries, it will really vary. It's just important to consider, let's say, like for instance, for a 1 hour Zoom call with video on, that might take about 1 gigabyte of data. So recompensing people for 2 or 3 gigs of data when they do join your call. So I think that the biggest thing is looking at the local rates, and then also establishing, ensuring that the reimbursement or the compensation is not significantly higher than a day's wage or how much someone would have spent for that specific amount of time that you are engaging with them, so that also you reduce the response bias.
Wonderful. Thank you so much for those responses and additional discussion. I think we're going to hand over to our final speaker now. If anyone does have any further questions for any of our presenters so far, please do feel free to continue to engage in the chat. Our final speaker is Dr. Musa Mabasso. Would you like to share your slides now and take over? Perfect, thanks. I don't think we can hear you right now.
Okay, hi, can you hear me now?
Now we can, thank you so much.
Okay, sorry, so I just have to go up my title page. Okay. Anyway, so my name is Musa Mabasso. I'm a researcher at the Human Sciences Research Council. I work in a research program called the Human and Social Capabilities Division. So like other research programs at the HSRC, we do surveys. Our focus is mainly on the social aspects of health. We do work on HIV and TB, but not limited to those surveys. And we employ both qualitative and quantitative approaches. And some of these surveys, especially the large ones, the large scale, we do large scale and small scale surveys. The large scale surveys are household based. So we go into households to interview people and we collect blood. Some of the surveys that we do are venue based or facility based. So now the common feature in all these surveys is the fact that they require one-on-one interaction, be it in the form of focus group discussion or face-to-face interviews. So the outbreak of COVID-19 really posed the challenge for the work that we do. In fact, it was a dilemma for some of the projects that were already in the pipeline. And I think this did not apply to my research division, but I think in other divisions within the HSRC. So we're really forced to start thinking how we're going to go about doing our work, and so some of the work had to shift. The timelines had to change, and we also even now the fact that we're on level 1, there's a possibility of surges and spikes as we've seen in other countries. How will that impact our work? So it's quite interesting to hear all these innovative methods that are being discussed in this platform. And I think they're quite relevant in some of the work that we do. But today I just want to talk to you about the work that we did in response to the COVID pandemic. Sorry, Julia, I was trying to go up to my first slide. I don't know whether, let me see. Oh yeah, there we go. So,
there we go.
So the work that we did it under a banner. We call it Frontline Talk. This was aimed at gathering crucial data on the response of South Africans to COVID-19 outbreak. And this was done under the leadership of Professor Priscilla Reddy, who's our lead in my division. The way I'm going to approach this presentation of this talk is that I'm going to give you an overview of the method that we used, which is similar for all the surveys that we did, with slight modification here and there where we had challenges in terms of recruitment. I'm going to also talk briefly about the reach. How many people did we manage to reach and what was their demographic profile? I'm also going to give you a taste of some of the highlights in terms of findings from these surveys. I'll talk also briefly about just the limitations of the work that we did, but most importantly, what transpired as a result of some of the work that we did in response to COVID-19 in the country. So, so the work that we did included both qualitative and quantitative studies. But in this presentation, I'm going to focus mainly on the quantitative surveys. The qualitative work that we did, just briefly, I think it was mainly photo voice, case studies. They also did key informant interviews. I think these were telephonic. There were also some social media studies that were conducted, and some of the key informants in the qualitative surveys that were conducted were teachers, shipping owners, and sex workers. So that's another interesting piece of work, given the fact that, given the other presentations, about the visual focus group discussions and all these things. So it's quite interesting. It'll be interesting for this group to also present their work in this platform. So, but I'm going to talk to you about the quantitative surveys I've already said. The first survey that we did right at the beginning when the epidemic was hitting us, this was conducted this focused on South Africans' understanding of the COVID epidemic and their response to COVID-19. And obviously the focus there was on knowledge, attitudes, and behaviors related to COVID. And as you can see, these were back-to-back surveys. And we immediately started also working on the lockdown survey, which looked at the experiences and the social impact of the level 5 lockdown among South Africans. So the two surveys basically focused on all those that were participants were 18 years and older. Subsequently, we then did another survey which looked at the experiences of healthcare workers in dealing with COVID-19 epidemic. And we did this work focusing on healthcare workers in both public and private sector. The last survey that we did, we just finished now, and we're busy sorting out the data. This was really out of the request from the ministry that we report to. This looks at the social impact of the COVID-19 pandemic among post-school education and training sector youth. So that's one component of the studies, two separate studies, but under one umbrella. And another one looked at the youth who are not in education, employment, or training sector. So as I've said, I'm gonna just give you an outline of the methods of the method that we used in conducting the survey. So all the surveys were conducted online. We used the Moya messaging platform provided by our partner, Vinu. And this platform was selected due to its data-free nature and its large user base. So the surveys were widely advertised. I mean, we've had the issues around trying to communicate information about surveys in the last two presentations. So the surveys were widely advertised through the HSRC, the University of KwaZulu-Natal, and through an extensive network with our strategic partners. Those included government, science council, non-profit stakeholders, the private sector. In the case of healthcare workers, it was the health professional bodies, and higher health for the youth survey. So press statements were released to inform communities and health workers about the surveys. So we really did a lot of work to try and publicize our work through radio and television and also social media. But with respect to the first two surveys, everything seemed to be going well, the first survey, but the second survey, we hit a challenge. As widely advertised and distributed information about the survey, the numbers were trickling in slowly. And so we had to engage, we had to supplement that with telephonic interviews. We got, I think it was about 1 million phone numbers that we got, but we managed to contact around 3,602 people out of those 2,682 participated in the survey. And here, these interviews were conducted in mother tongue language. This was during the lockdown survey. Now, one other biggest challenge that we faced, and we're looking at this because remember now the survey, the information that we were collecting, we wanted to generalize it to either the South African population or the targeted groups that we're looking at. This is one way, it's a short way, but it's allowed to even with not non-probability studies. So we did what we call benchmarking for the general population surveys using the mid-year other population estimates from Statistics South Africa. That applied to the first survey and the second survey and the youth survey, the non-out-of-school youth survey. But for the in-school youth survey, we had to source information from higher health. So the benchmarking will help us to be able to say something, at least, about the population that we studied in the country. Now, the social behavioral survey, the first survey that we did, this is just now showing the reach. You know, how many people did we manage to get? It's 55,823 individuals were recruited. And the majority of them were between the ages of 30 and 39. They were female, they were Black African, they were full-time employees. And this information is quite critical. You see at the NY, they resided in informal playing type. And the majority of study participants came from Gauteng, followed by KwaZulu-Natal and Western Cape. And the lowest response, of course, from the Northern Cape. So now this was with respect to the first survey. And so what transpired, what came out of the survey, I'm going to share just briefly some of the findings that came out of the study. So we looked at knowledge of transmission and symptoms. So the other things that we looked at that I did not cover here. But at the time when the epidemic was, when it was taking root in South Africa, 2/3 of respondents correctly identified 4 possible ways of how the virus is transmitted. 83% correctly identified all 3 main symptoms of COVID-19 infection. It was quite encouraging. And we also looked at self-perceived risk. How did people perceive themselves? How do they see themselves in terms of getting infected with COVID? 25% rated their risk of contracting COVID as either high or very high. And this was mainly due to their work environment where they work, or due to underlying medical conditions, and those that were Asian. So they correctly identified themselves as being at high risk of being infected by COVID-19. Then we also looked at the preparedness for quarantine isolation during lockdown. 50 to 57% of people reported buying hygiene products, hand sanitizer, and cleaning supplies in preparation for lockdown. 64% reported that their home had a separate space in which they could isolate. So all this information, remember before we didn't have all this information. It was for the first time that we're getting population data that give us an indication in terms of the preparedness of the people for COVID-19. And as we all know that some of the policy, the regulations were evolving as the disease was developing. So this was vital information in terms of informing that process. And the last but not least is the information about COVID and its trustworthiness. So 23% of respondents thought that the threat of COVID-19 was exaggerated in the media, while 48% of people felt that the situation is likely to get worse. So all of this information is quite vital and important. I'll tell you why. And we did not have this information at the beginning, and yet we had meetings, people coming together, talking about COVID, and yet we have this public and social interventions, and no one is testing and seeing how people think and how they respond to these interventions. So this was quite a vital piece of information that was coming out from the ground. Now, with regards to the second one, this is now the lockdown survey, looking at the impact of lockdown. We just managed to get 19,330 people to participate in the survey, and the majority of them were in that age group, 25 to 59. Almost an equal proportion of male and females, and of course, majority of them were African. Over a third of participants were employed full-time and unemployed, so almost the same numbers there. So the pattern follows the first survey. The majority of the participants came from Gauteng, followed by KwaZulu-Natal and the Western Cape. Most of them reported that they stayed in the township, and 27% or resided in the suburbs. Again, look at the group of people that we're tapping into. So what transpired from this survey? So the survey revealed that most people adhered to lockdown regulations. 15% had to use public transport to get to the shops. 51% of people reported that they came into close contact with 10 or more people. This was an important piece of information for the government's communication strategy. Just under a quarter of residents had no money to buy food. More than half of informal segment actually had no money for food. 13% of people reported that their chronic medication was inaccessible during lockdown. And the majority of this, most of these people, just 20% were from informal segment or rural traditional areas. Between 45 and 63% of people reported that the lockdown would make it difficult to pay bills, debts, and income, feed their families, and keep their jobs. And 11%, so cigarettes were more accessible than alcohol. That is what came out of the survey. And a quarter of people in the informal segment could buy cigarettes. And this last piece was in the media, was interpreted differently, and was used in the fight against the banning of tobacco. It featured Fair Trade something Tobacco Association. This ended up in the courts. We used the information that we had collected. I was part of that team, and we won both two court appearances through the survey data that we collected. Now, the healthcare workers survey, if we look at the distribution, we had a total of 7,607 healthcare workers that participated in the survey. The majority of them were females, and 70% were aged between the ages of 30 and 59 years. And only just 10% were older than 60 years. And this is vital information, the age distribution, because these are people in the front line and who were exposed to COVID. Of course, the majority of them were also Black African. Again, if you look at the distribution by provinces, it follows the same pattern with Gauteng, KwaZulu-Natal, and Western Cape having the largest numbers. If we look now in terms of what we call community type, you'll see that over 60% of the healthcare workers worked in urban formal localities, and only just 2.9% work in rural localities. Now, this could be a question of reach. We're going to discuss it, as has been discussed in other presentations, the digital divide. This just gives you an idea in terms of the groups that we focused on, because we had nurse practitioners, we also had medical practitioners. But the other group comprises of all the other people on the other side of the triple graph. So this is the distribution by sector. You see that, of course, we tapped, most of them were in the public sector, followed by private sector, but there were also people who were working between the private sector and the public sector. Okay, so what were the highlights of this particular survey, the results? This was a big issue. This survey, I can't remember now what it's called, National Health Council, where all the health ministers and their director generals converge. They have these meetings. They had regular meetings during the COVID, the height of the COVID epidemic, and this work was presented to them, and it was discussed in terms of how they were going to deal with the issues that were coming out of the survey. So there was a lack of proper training in the use of PPE. So in terms of which were appropriate under which conditions. And there was a lack of confidence in the training received on COVID-19. Knowledge on the use of PPE, we could link it to the level of confidence in managing COVID-19 positive patients. Now, this is really vital information. And we found that when knowledge was low, confidence was also low, and this perception increased. There was poor communication about COVID to healthcare workers. Now, this for us was a bit strange. We'd expect that they get regular information, but they complained. There were a lot of mixed messages. They needed timely, factual, and trustworthy information. One of the biggest things, again, that came out of the work that we're doing is the fact that healthcare workers required psychosocial support, particularly with the rapidly growing pandemic, with the rapidly growing or evolving pandemic in the country. So the rapidly increasing number of cases and deaths affected their mental health and their well-being, general health and well-being. So some of the things that came out so as I've said, I'm just going to discuss the three first survey. The last survey that we just finished now, we're still busy cleaning the data, and we'll be sharing with the public soon. So I think this has been discussed in this platform, some of the limitations of online surveys, because some subpopulations are less likely than others to have access to internet. And of course, the survey is drawn through online surveys based on website visits. So other people who don't have access totally missed. The unemployed, those who live in informal dwelling and rural areas. As you can see the numbers, if you look at the demographic profile, that we hardly tapped into the rural population. So the disproportionate participation rates are likely to reflect the digital divide, as has been discussed by previous speakers, and issues around connectivity and access to technology and the internet. So that, I think, is one of the biggest challenges. But I've had in the previous presentation some of the innovative ways that you could try and deal with some of these issues, and I think that is quite interesting. So in conclusion, the surveys that we did highlighted the importance of social sciences research data in the fight against COVID. And there were a number of discussions following the first and the second surveys. There were a number of discussions, and were invited to the meeting that I mentioned, but also the meeting between the Minister of Science and Technology and the Minister in the Department of Health to discuss the issues that we need such data, even in modeling. There's no reflection of some of these data sets, and that social scientists need to be engaged at the outset of public health emergencies. And here we're not only just talking about COVID, but in the future that there should be systems in place. You can't just be biomedical scientists. There's no biomedical solution as yet. So social scientists should be part and parcel of some of these engagements, especially when it comes to epidemiological data. And so a lot of positive things have come out of the work that we did and the interaction that we had, to such an extent that I'm aware that there are systems and structures in place that aim to make sure that there's ongoing interaction between social scientists, governance bodies, and other stakeholders. And like I said, not only for COVID-19, but also in future outbreaks. They happen in societies and communities. And currently with COVID-19, the only interventions we have are the public health interventions. Okay, thank you.
Great, thank you very much. This is Tara, just taking over from Julia for the last bit. That was fantastic. There are a couple of questions in the chat, but maybe not everything everybody wants to add. Can I just ask if there's anything else from the audience? And we've got 10 minutes left, so very happy for people to actually speak up. just give us a hand. In the meanwhile, Musa, would you look at the questions that are there?
Yeah. Yeah, the number of ideas. I think when we did this the second time around, I mean, remember that it's more or less the same group of people that have access to these websites and to these links. And we think that people were sort of like fatigued. I mean, there was great response with the first survey, and the drop was just so huge with the second survey. We had to, in fact, supplement it with the telephonic interviews. It was a huge challenge. So I think that for me, that was one of the reasons that it's the same group of people and you keep on. And if you look at these surveys, they were actually back to back. So there was no time in between. So that's one of the major limitations. We're working under duress, under emergency conditions, and when we presented the first study, there was a call for more. They were asking for more things. That's why we started with the lockdown survey. So we paid the price for having these back-to-back surveys and not interviewer participant fatigue. I think that's one of the reasons. We'd love to hear about your experiences reaching more. I don't think I have an answer to this question. Even under normal conditions, when we do research, they're hard to reach population. There are specific methods that we use, snowballing, the hidden populations through respondent-driven sampling. That is a serious question, and I think I would love to hear what others think, because I don't think that I have an answer to that question. I think it's most difficult, especially during the lockdown. I think it would have been more difficult because even under normal conditions, there are specific methods that are designed to try and tap into these groups. I don't know whether that answers you, Julia. Yeah, so so that's how we try to deal with underrepresented group through weighting. Because if you looked at the raw data, just the distribution by race, then you could see who has access to what. It was completely skewed until we benchmarked it against the South African population to try and correct for that. But having said that, so that's the only way that we try to deal with that. And this method is, we've always tried. For example, I mean, I'll make an example with the youth survey. When we did the youth survey, the focus was on technical and vocational education and training colleges, universities of technologies, and what we call SETAs. I think it's sector education and training authorities. There are some colleges that fall under that. We got good response from universities and some universities of technologies, but there was nothing coming from TVETs. It was difficult and understandably so, because some of the students did not have access to computers. So we engaged with Higher Health, who then contacted the TVETs colleges across the country. And they in turn contacted their students, called them, and some students had to go back to the colleges, those that did not have computers, so that they could have access to the link. So those are some of the things that we tried. But in terms of the racial groups, it's a challenge that we've always had with our surveys. It was worse during COVID-19. I mean, how do you do it? It's a challenge, but we definitely tried in the case of the youth survey. The numbers are not looking good, but at least we have something that we can work with.
Thank you, Musa. I think we've had several sessions in this series where people have talked about the challenges of getting representative samples in a remote environment.
Sorry, I can't hear.
Oh, sorry. We've had several sessions in this series where people have talked about the challenges of representative sampling in
Yes.
this environment, in a remote environment. And I think we're all struggling with those same questions. And it's going to take some time, I guess, until we all find, until kind of standard operating procedures shake out again.
Just to say, one
yes.
way that we thought of doing it is just that the time was against us. You know, when you have, like, for example, a list, we're thinking if you can get a list of, especially with telephonic interviews, you can randomly select, try and come up with some kind of probability sampling if you randomly select from a list. But the question is, where do you get the list? From the banks? You know, so it has to be a comprehensive list where you can randomly select people that you want to interview telephonically. That's one of the methods that have been used in other online surveys.
No, exactly. Just a quick question, actually, to all of the speakers and maybe to the audience as well, to our participants. Has anyone come across a situation where the actual cell phone providers have been involved and willing and able to provide a kind of comprehensive or random sample of phone numbers? Because in a sense, that would be a kind of list. Obviously, there's ethics and POPI and probably Communication Act issues around all of that as well. But I'm just wondering if that's ever been tried or if there's a way that anybody's heard of.
So I can speak to that. I don't think any cell phone providers have done that. However, I know some of the service providers that we have worked with have a database of phone numbers and certain characteristics. So for example, if they're male, female, youth, in some instances, they have sector information as well. And they actually sell those numbers. I think they have gotten the ethic rights to, ask participants whether they would like to be involved in future, for example, research, and that's how they've kept the phone numbers, but not the cell phone providers, but the data collection partners themselves.
Yes, there's some of those in South Africa as well that we've worked with, but there's always some bias in there, which we all know and kind of aware of. So I think we're all collectively looking for new ways and keeping the innovation going. So just to sum up, thanks again to all of our speakers, 5 today. So that was wonderful, and thanks to all the participants for your questions and for being here. What I'm hearing today, which has sort of been the theme of the whole series, is that there's an incredible amount of innovation happening, which is wonderful. And there's sort of different kinds of innovation, right? So some of it is existing tools and methods like the automated voice studies that were already present, but have now taken on a sort of new life and new kinds of scope and scale and application. Then there's some innovations like the boot camp, I think, which is taking an analog idea, but by going remote has somehow really changed the nature of those engagements by making them much broader, much more accessible, much faster, much cheaper, and therefore sort of actually scalable. And then there's other innovations that essentially where we're trying to often maybe not very successfully replicate some of the things that we were doing standard operating procedures before, needing to go remote. So all of these questions about how do you generate a representative sample, and where we're sort of putting together lots of different building blocks to try and make that happen. Some of these innovations sound like they're definitely going to continue beyond the COVID period. So it's great to hear the JET boot camp idea that this obviously can continue. Some things I think are probably stopgaps and where we're going to be quite happy to go back to face-to-face work, or where there's going to be some hybrid and we're going to learn, but we're not going to throw our face-to-face experiences and good processes out the window. It's kind of like, you know, when we got to music streaming, we haven't cut off radio. Like the radio is also still there. So I guess what the question keeps being is, how do we really think through our innovations? Which ones are durable? Which ones were second best stopgaps, and it's fine if we go back to our old ways of doing things. But having learned some good questions about what we assume to be normal and whether that in fact needs to be normal. So thank you, everyone. The last session in this series is going to be on the 22nd of October, which is again going to be really fascinating because it's going to be people talking about going back to quote unquote normal face-to-face fieldwork. And the challenges and the innovations and the novelties that are coming out of going back, quote unquote, to something after this unusual period. So I hope that you'll all join us, and please do pass on the invitation to colleagues to come and join that conversation as well. Thank you, everybody. As usual, I think it'll be a couple of days, but then the recording of this session will be on the GCRO website, and the slides will be there, and you can all come back to it and remind yourselves of things that you found particularly interesting. All right, thanks everybody. Thanks Julia, as always, for organizing, and Ben as well, and all the other organizers behind the scenes. Timbiso, thank you. And we will see you all in 2 weeks. Bye.
Bye.
And thanks,
Bye.
Tara. Thanks, everybody.
Yes.